Prepare for insertion by lowering the instrument handle to establish a 0-degree angulation. Gently slide the working end beneath the gingival margin and onto the distal surface of the root. Pause to check your angulation. Remember that the face of a universal curet is at a 90-degree angle to the lower shank. If the lower shank is parallel with the distal surface, the face-to-tooth surface angulation is at 90 degrees. The lower shank must be tilted toward the distal surface to establish correct angulation of between 70 and 80 degrees. Adapt the toe third of the working end to the distal surface of the root. Imagine that you are locking the toe third against the toe surface. Instrument at least halfway across the distal surface. Reposition the working end for the facial surface. Gently slide the working end beneath the gingival margin. Imagine the face sliding along the facial surface all the way to the base of a shallow pocket. Lock the toe third and make controlled instrument strokes across the facial surface. Be sure that each upward stroke is distinct and that you pause slightly to relax your grasp and slide the working end back to the base of the pocket. As you approach the mesiofacial line, roll the handle slightly to maintain adaptation. Keep the toe third locked against the tooth surface during all instrumentation strokes. Make sure that your strokes extend past the midline of the mesial proximal surface. Use of horizontal strokes. Horizontal strokes are extremely effective in removing calculus near the distofacial and distolingual line angles of posterior teeth. Insert the curet slightly distal to the distofacial line angle. Lower the instrument handle until the curet working end is oriented with the toe toward but not touching the base of the sulcus or pocket. Begin a calculus removal stroke slightly distal to the distofacial line angle. Make several short controlled strokes around the distofacial line angle. After completing several strokes, reposition the curet to continue making oblique strokes across the facial surface. Technique alert: lower shank position. An inexperienced clinician may lower his or her dominant hand and tilt the instrument handle down in an attempt to gain direct vision of the mandibular lingual surfaces closest to them. Tilting the handle may make it easier to obtain direct vision of the lingual surfaces, but it also makes calculus removal difficult if not impossible. This incorrect handle position causes the lower shank to touch the lingual and occlusal surfaces of the crown. In this position, it is not possible to adapt the working end to the root surface because the root is smaller in diameter than the crown. When working on the lingual surfaces, keep the handle in the normal position and use your mirror for indirect vision. With the handle in correct position, the lower shank is not in contact with either the lingual or occlusal surfaces of the crown. In this position, it is easy to make oblique or vertical instrumentation strokes up the root surface without rocking the shank against the occlusal surface of the crown. Use of a universal curet on anterior sextants. Choosing the correct working end, anterior tooth. Adapting a universal curet to an anterior tooth requires a technique that is very different from that used with any other instrument. Practice selecting the correct working end for the mesial surface of the central incisor. Place one of the working ends against the midline of the facial surface. Carefully look at the working end. If the instrument face tilts slightly away from the tooth surface, you have selected the wrong working end. If the instrument face tilts toward the tooth surface so that the face is partially hidden, you have selected the correct working end. Once you have the correct working end, adapt it to the mesial surface. Note that when using a universal curet, the lower shank reaches across the facial or lingual surface. To help you remember this, think, for a universal, look for anterior across. Technique practice, Universal Curet on anterior sextant. For this technique practice, work on the mesial surface of the mandibular right central incisor. Aim the toe of the working end toward the mesial surface, as this is the direction in which you will be working. Place the working end in the Get Ready zone. Gently slide the working end beneath the gingival margin to the base of the pocket. Lock the toe third of the working end against the tooth surface and begin making strokes. As you approach the mesiofacial line angle, roll the instrument handle to maintain adaptation of the toe third of the working end. Continue strokes until you work at least halfway across the mesial surface.